Nearly 2.5 years into the pandemic, COVID-19 has touched the lives of nearly everyone in the world. But imagine having an entire family of frontline workers all fighting the pandemic in their own way, touching the lives of so many people in our community.
Our Elspeth Miser reports with part 2 of Family Medicine.
It certainly wasn't easy navigating a pandemic as a family. While Linda Caputo worked in UPMC Hammett caring for COVID-19 patients, her husband Jim was organizing vaccine clinics for LECOM. They worked to protect others from COVID-19 while hoping they didn't get the virus themselves. Linda Caputo has worked as a nurse for 41 years, but seeing a hospital overrun with COVID-19 patients was something she never could have prepared for.
Hospital was overloaded with COVID, and we all had to take turns working on COVID units in the full gear. And then I'm afraid to bring it home to the family.
While Linda was helping patients suffering from COVID-19 at UPMC Hammett, it was her husband Jim testing people for the virus and then vaccinating them at LECOM's clinics.
A really big learning curve for me very rapidly, and I never imagined, and even hearing it early, the full ramifications of what it involved and what we see now with society, supply chain, economics, with everything that's gone with it.
Like many others, Jim felt the roller coaster that came with COVID-19 was grueling.
And then there was an immense letdown for me, like around May, June, I guess even more in June of 2021, when it seemed like, wow, you know, we had folks that were lined up when we were at the Bayfront, almost out to the Bayfront Highway in double lines trying to get in the building. And now we were down to maybe 100 people a day, and that trickled to 10. And I was like, wow, what happened? I feel like I threw myself, into everything. And it was a little bit of a letdown.
From a big interest in testing and vaccines to seeing few lined up, his son-in-law Marcus also felt the effects of the pandemic as the hospitalizations rose.
We saw our highest number of hospitalizations and deaths, and this is 2 years after the beginning of the pandemic. So just to see the cyclical nature and how it keeps coming in that sine wave, and every time where you think that you just have it beat and we're going to get back to that life pre-COVID, it seems just to always come back around. And
it wasn't just Mill Creek Community Hospital that felt the effects of patients suffering from COVID. Linda was busy seeing patients around the clock at UPMC Hammett.
Wish we could do a documentary in the hospital to show people just how real it really is.
While the pandemic brought lots of uncertainty, it also brought unity among healthcare workers, including the Caputo family.
I think we definitely have areas where we collaborate. The COVID stuff has been a big one as far as the testing and vaccine goes. But I think normally, there's collaboration, but we don't see each other as often as you would probably think.
Marcus said after living in a pandemic for years, now it's all about learning to live with the virus and doing your part to protect yourself and others.
now it's more of, okay, everyone needs to be educated on the signs and symptoms of COVID. What is different between COVID and the seasonal flu? What's different between COVID and allergies? Recognizing those symptoms so that you can test yourself, isolate yourself, and if applicable, get the appropriate treatments to protect the rest of the community.
From Linda to Jim, Jamie, Marcus, and Lindsay, they said even when they have challenging days or they're overwhelmed with COVID-19 while serving the medical community, they're lucky to lean on each other, especially since they each know what each other is going through. Elspeth Meisner, Erie News Now.